Hi, I'm Maggie Stasek, Program Director for ASCP and licensed esthetician. In today's training, we're going to clear up a common confusion: the difference between dry skin and dehydrated skin. As professionals, understanding this distinction helps us make better decisions during skin analysis and tailor treatments more effectively. Let's break it down. Dry skin is a skin type, and it's caused by a lack of oil. You might see rough texture, flaking, a dull tone, or a client may express a tight feeling, especially after cleansing. It's also more prone to sensitivity and irritation. Importantly, a dry skin is typically chronic and doesn't fluctuate much with external conditions. Dehydrated skin is a skin condition, and it's caused by water loss. Any skin type, oily, dry, or combination, can become dehydrated. Common causes include weather, diet, lifestyle, or products that strip the barrier. The upside: it's usually temporary and correctable with the right care. So how do you tell the difference during a skin analysis? Try the skin Turgor test. Gently pinch or push up on the skin on your client's cheek. If it's firm and bounces back quickly, hydration is likely sufficient. If it looks crepey or takes a moment to return to its resting position, that may be a sign of dehydration. It's a simple but effective assessment tool you can use right away. It's also important to note that most skin types will have some degree of dehydration, especially in areas around the nasolabial fold, under the eyes, or at the forehead. Another sign of dehydrated skin is an imbalance of sebum production, especially if the skin feels tight or has rough patches. This imbalance is your cue. The skin may be overproducing oil to compensate for a lack of water. In contrast, truly dry skin looks and feels matte and rough all over, with little to no oil production. Understanding the difference between dry and dehydrated skin helps you choose the right protocols and products, whether that means replenishing lipids and boosting hydration or exfoliating scaly skin. You're not just treating the surface, you're restoring function. That's it for today. I hope you feel more confident identifying and addressing dry versus dehydrated skin during your facials. Thanks for watching, and keep empowering your clients with skin knowledge that works.